The discharge information is crucial to us to be able to continue caring for the patient safely. Some narrative is important, I think, to understand what's happened to the patient. For example, if we've had somebody that's discharged for end-of-life palliative care, those sorts of discharges sometimes are written very well, and that really helps us to understand what's happening with that patient, particularly as we may not have known them previously.
When we receive a discharge summary, if I was to prioritise anything, it would be that column that says actions for the GP. When we are reviewing patients, occasionally they do say that the doctors at the hospital told me to do this, told me to do that, and that information that we can compare, or we can say, I've looked through your discharge summary, this is what's happened and this is what they've advised. It puts us in a better position to manage them as well as managing their expectations. Second most important column would be medications. Medications given and any medications changed. We receive requests for medications from patients saying that they've been asked to stop a certain medication, start a different medication, but without the information for us to do that, there is a high clinical risk attached to it.
It's important that any things like medications, any investigations that we as GPs understand that have taken place, and so therefore we don't request unnecessary investigations, both for the patient's perspective and our perspective. And secondly, if there's been referrals that have been made, we don't duplicate those referrals. So to be honest, it's paramount that we have this communication tool between secondary care and primary care.
One of the things that is really important to recognise is the importance of following up any tests that are done in the hospital. Rather than asking the GP to chase investigations that are done, sometimes that can be quite unsafe, and a discharge summary might suggest that a GP repeats a blood test in 5 days' time. The difficulty with that is if we haven't received the discharge summary within that 5 days, we may receive it after that time, by which time potentially that patient is missing an opportunity to have their medication safely reviewed.
In the environment that we work, time and access is something that is generally quite precious, I would say. If we can have pertinent, concise information focusing on what's been done and what needs to be done, that will benefit us personally as general practitioners as well as general practice as a whole.